So, what level of exercise should you do after your brain injury? And boy, I wish I had known some of these things before I started exercising. But you need to exercise within your limits. And what I mean by that is the limits of whatever your physical therapist or your occupational therapist or your other brain injury specialists say. Um, you could also have limitations based on what you can do for exercise if you have other injuries. And the other thing is monitoring your brain injury symptoms. So if your brain injury symptoms worsen when you exercise, then you're pushing it too hard, and you need to back off and kind of operate below the level of developing brain injury symptoms. So, some of those symptoms that you'll want to monitor for are shortness of breath, rapid heart rate, um, fatigue, exhaustion, pounding headache, or worsening pain from any of your other injuries. This is when you know you're pushing it too hard, too fast. Now, so like I said before, you want to exercise kind of below those symptoms. You want to exercise to the point where you're not pushing yourself to developing those symptoms. However, though, as you recover and as time passes, there is going to come a point where you're going to want to push it a little bit to expand your efforts and your abilities. And so, really, sometimes what it comes down to is finding the balance that works best for you. Pushing it when you feel good, pushing those boundaries a little bit when you feel good, and staying within those boundaries on the days that you're not feeling great or it's just a bad brain day.